you're only one in the family struggling with like diabetes or hypertension, the habits of other family members are tempting you or causing you to, fall back on your plans. Any other tips for those patients?
I don't know. I feel like there's something about the brain that says, "Rare," when you try to take away. Let's add to.
Yes.
So how about we look for more protein substitutes? So beans, there are over 400 types of beans. Beans as a protein substitute over eating beef all the time. Or I say, let's add less starchy fruits and veggies to each meal. Another one is getting a fruit basket for your kitchen aisle. I have one that's this high and I have one on the table. And so the kids accidentally eat fruits and veggies all day because it's there. They say they have a conversation
I
about
love it.
Hi, this is the Care Room with Dr. Cindy. Welcome. It's a space that was created just for you. I'm your host, Dr. Cindy, and this is a chance to get up close and personal with me. We're going to talk about the things in medicine that matter to you. We'll talk about the questions you've been carrying. We're going to have some honest conversations. We're going to hold space for joy, struggles, and everything in between. It's care that goes beyond the exam room. Care you're going to take home with you, whether you're listening while you're driving or you're listening while you're exercising. I promise that it's going to be care that's rooted in truth and a deep commitment to walking with you every step of the way. I'm glad you're here.
Hi, everyone. Welcome to another episode of the Care Room with Dr. Cindy. Today, I'm so excited. I have Dr. Tolu Olabintan with us today. She is an excellent physician. She's located down in Texas. She is here to share her wisdom. Today, we're going to be talking about, diabetes and hypertension and what we almost label a generational curse. And that's what you're going to hear about today. And we're going to dive into that. But first, before we dive into that some more, I'll let Dr. Tolu, as I fondly refer to her, introduce herself. all yours, Dr. Tolu.
First, Dr. Sydney, I want to appreciate you for the privilege of being on your podcast. I love what you do. I love your energy. I love your vibe and your poise. I got to say,
Thank you.
Love it, love it, love it. So I'm Dr. Olabintan. I am a family physician, a lifestyle physician, also obesity medicine physician. I'm a life enthusiast. I love helping people live long and well because I do believe the quality of life is just as important as the quantity of life. I am a Christian, so my faith is a big part of my healing journey and also how I dispense medicine. And now I'm also a wifey, mom, and I'm a dog mom too, 2 golden doodles.
Really?
And I'm excited to be having this conversation so we can break generational
curses. Let's do it. So, Dr. Tolu, I know that, as a family physician, lifestyle physician, obesity medicine, you probably see this quite a bit, right? Diabetes, hypertension. How would you say you first approach a patient who comes to you? They're concerned. They haven't seen a doctor in a while, as a lot of patients tell us, doc, I don't like doctors, but I just come because I have to. How do you approach those patients?
So, it's sometimes, of course, taking the history. How long? What medicines have you tried? What do you know about the disease?
Sure.
That's where I hear, I don't know, they say my sugar is high, but I'm fine. They say I have high blood pressure, but I feel no pressure.
Yep.
My cholesterol is high, but I don't hurt. Like, it doesn't bother me. So it's almost like, it's a question of what do you know about the disease? Like, how seriously do you take it or do you think you should be taking? And then have you tried medicines before? And what has worked? What has not worked? What's your why? So what does feeling healthy or being healthy mean to you?
Right.
And so for some, they don't care that their numbers are better, but they want to feel better. They want to have more energy, or they want to live or outlive their parents. So it's a lot of questions about their history, about their awareness of their history, about what they've done, about what they want before I then present what I think we should prioritize, lab results and, of course, family history. Who has it? What have you seen or, from people who have it? What do you not want? So that first visit is kind of like getting to know you, kind of get the feelers out and ask all the questions. And then I'll be honest, I have my agenda already. Like, whew, you got the
Trifecta.
trifecta. That's like diabetes is like having had a heart attack. High cholesterol, high blood pressure. That's like a
Right.
triple recipe. They're like the three musketeers. I um consider of near death, like heart attack. And so I'm ready to like karate it out of your life. But I have my agenda, but I want to gauge, well, how receptive are you to it? And then what's a priority for you and how do I tie the two together? Because those three, of course, are red flag for me.
Sure, sure. So, have you, in terms of your practice, because I know you said you approach like from a faith standpoint as well. Do you typically recommend lifestyle changes first or medications? And can you tell us more about your unique approach?
To be honest with you, it depends. Depends on how high. If they have their own labs and your A1C is 11, and you're telling me you don't want medicines, and I've had patients telling me, "Oh no, I'm a child of God. I came to you because you're a Christian. I reject that in Jesus' name." And I say, "Yes, sis, I reject that with you, and I'm in faith with you." And so we're going to prayerfully consider medications plus lifestyle, and
Mhm.
ask God for grace to do the things to not be in this position within your power, and then with or without medicines, adjust your A1C. All right.
Mhm.
So I've had patients who actually went from A1Cs of 11 to zero just by the continuous glucose monitor. They agree that they would pray. They will find other outlets to de-stress, not food that are sweets because that's their craving. They would exercise an hour after meals and use the meter to kind of see if their decisions were the good ones, and
Right.
adjust and align. All right. So a lot of it is based on, I have like, I want to tell you all the things, but I found that bite size works. But of course, depending on the urgency, if you have an A1C of 11.5,
Mhm.
I'll be a little more aggressive. And there's always lifestyle. It's a question of what lifestyle approach they want to take. Is it the exercising? Is it okay? I'll tell you the funny story. I had a patient who told me she would go to fire me. She planned to fire me after she met me because I told her to give up soda the first day I met her.
Oh my
She was like,
God.
"Girl, you extra. You just met me. You do not know me." And she said, "I only came back because I was sick and you could get me in and I like your staff." She's like, "You were too much." And I said, "Oh, I'm sorry. You were diabetic. To
Wow.
me, soda is like, no." So
Right.
we settled on sweet tea. We looked at the sugar.
Nice.
It was Chick-fil-A sweet tea. And we agreed that compared to um, Pepsi,
Got it.
the Chick-fil-A
Sure,
sweet
sure,
tea was a little less.
sure. That was nice of you to
I
work with her on that. Yeah.
she
You
and
kind of had
she
to.
was fired me. Yes, I did. So it's dynamic, but there's always the lifestyle
Right,
piece,
right.
you know,
Do you
always a lifestyle.
tend to involve the family in with those conversations or yeah.
You will agree, Dr. Sini, that people are more likely to make better health decisions when their family supportive. It wouldn't be fair if I asked you to eat romaine lettuce for snacks, which I do. I actually eat romaine lettuce as snack. I like it. They have a little sweetness to it, and everybody else is eating the burger. It wouldn't be fair. So I usually say, how about you have a family meeting and say, I'm trying to make some health changes. I was wondering how you could all support me in this, and also kind of revamping the fridge. Because if you threw away everybody's snacks and everybody's food because you on a journey, it could cause a ruckus in the house. So it's more, okay, I ask, do you have someone who could support you in this journey with this change? Oh, my husband's a help nut. He's a little extra. He'll help me. Or, oh no, my husband is worse than I am. Or, my son is worse. So, so then it's okay. What can we do? I actually had a patient get her own fridge, a small fridge in her
Oh,
office, so she could put her own stuff and go there and healthier snacks, so she doesn't have to keep going to the fridge and seeing other things.
other
I
things.
said, if you can afford it, hey, good for you.
That's
But even with involving the family, I encourage people not to give up on their family members. It's your individual journey. Sometimes your change, your transformation makes the other family members curious, like, oh wow, she looks good, she's feeling better, she's having more energy. Maybe I should start copying her.
right, right. I love that. That, she got her own fridge. That's amazing. Have you come across any other like tips that, if you're the one in the family, only one in the family struggling with like diabetes or hypertension, and other the habits of other family members are tempting you or causing you to fall back on your plans. Any other tips for those patients or that
So
you've
I
come?
tend to say, if you don't want, I don't know, I feel like there's something about the brain that says rare when you try to take away.
Yes.
So I'm like, let's add to. So
Yes.
how about we look for more protein substitutes? So beans, there are over 400 types of beans. I googled because I have patients telling me, well, I don't know how to. I'm like, there are 400 of them. You could pick some. So beans as a protein substitute over eating beef all the time.
Mm.
Or I say, let's add, less starchy fruits and veggies to each meal,
Right.
right? As opposed to, oh, throw away your ice cream. Or things like, I had one I say, get a small spoon. If you have to eat ice cream, don't buy the tub. Buy the small ones, put chia seeds in it, put raspberry. Berries are very good for
Nice.
diabetics,
Okay.
and they're relatively sweet. So you
Right.
could put that, so less of, you
Right.
know, I used to be the no, no, don't this, no, this. And it wasn't working. Patients would do it for 30 days and disappear and come back. Like, so sustainability. So it's meeting people where they are and then adding the things. Another one is getting a fruit basket for your kitchen aisle. I have one that's this high and I have one on the table. And so the kids accidentally eat fruits and veggies all day because it's there. They see, they have a
Accidentally.
conversation
I
with Dr.
love it
No, so it's a
because
good
it's
conversation piece. And then hmm so it's a good conversation piece.
sure, sure. Dr. Tolu, do you see kids in your practice? A lot of
Yes,
them?
I do.
Yeah. So
Yes,
how
I do.
how do you handle that? Like say, one of your pediatric patients, those are kids, guys, who's struggling with, obesity and we're concerned, like their cholesterol might be high or they're borderline diabetic. Again, with the whole family, dynamic. How do you approach those patients?
Now, kids, that's a sensitive age. So you have to be
Yeah,
careful how you project.
exactly.
Like, I want you to look a certain size to be healthy. You don't want to also damage your self esteem. But a lot of those habits are learned. If you eat healthy as a parent, there's a higher chance that your children will eat healthy. And that's why a lot of conversations are being had. I emphasize, I tell the parents, I say, for your future generation, it's easier if you're making healthier choices for them to make it a habit. So it would not be a struggle like it is for you now. So,
Mhm.
case in point, people keep like I can eat. I heat up green peas for lunch, protein, and I actually enjoy it. I
Mhm.
snack on romaine lettuce.
Mhm.
Like it's normal. It's why? Because my mom would reward me with fruits and vegetables when I did well in school. I would get the
Oh,
biggest papaya, or I would get the biggest guava, or I would get like that was our reward system. It was not cake and other things. Like that's
wow.
how. So
Okay.
it became second nature to be not seen as a punishment. But what do? Eat your vegetables. You're not gonna get candy if you don't. But then when they do a good job, we'll give them candy. So it's reinforcing that sweets are a reward and veggies are a punishment.
Mhm.
So my kid's like, oh mom, I did well. I love you so much. Here's an apple. Mom, I said, of course I'll give you something. I won't give you something that can erode your stomach like soda to reward you. Like that's kind of counterintuitive. And my son's like, I roll, mom. It's like, mom, you gotta be extra. I'm like, I'm just saying I love you. So I'll give you something that's good for you, not something that's not good for you. So it's the balance and I negotiate their snacks. So
Okay.
it's not fair for them to have my son has given me feedback. It's not fair, mom. My friend's snacks look cooler than mine. I'm like, okay, all right, fine. So I want you to advocate for why, knowing what you know and knowing that I love you too much to want to give you something that's not very healthy for you, even though you wouldn't like that I do that. So I love you past that. So you tell me. So my daughter has come back with seaweed snacks, crackers. They
Okay.
have dried fruit. They would do one that's plant based, no sugar. They look at wheat bread and they would say, Mommy, this is sweet. It has 2 grams, 3 grams of fiber and doesn't have much added sugar compared to if we get the Hawaiian rolls. I'm like, okay, that's fair. Mom, can I have avocado so I can make avocados toast? Okay, mom,
Okay.
can you order guacamole? I like that on my bread when I toast it. Okay. Mom, ugh, brown rice. No, I'm not doing brown rice, mom. I'm like, okay, how about I put when I make fried rice, I put the green peas in it. So it's negotiating. It's not nice. Sorry, I'm saying a lot, but it's not nice to deprive the kids. It's balance, but what's the next best thing? And then you model the behavior. Don't say because the person is overweight or have a chronic disease of obesity that they should eat leaves and not eat. And anytime they eat, you huff and puff on them, but you eating whatever you want because your genetic makeup allows for you to. That's not nice.
No, I agree. I agree. I agree. So, going back to our theme of that generational curse, um, can you talk about genetics and the role that it plays? And I guess this is two questions in one, but um, do you feel like certain cultures are more predisposed to in terms of um, getting those
Yes,
diseases?
the data does show African Americans, Mexicans, like there's short there's a genetic component to it, but that's not the whole story. Some of it is family shared lifestyle patterns that move down.
Agreed.
So I have people tell me, oh, it's genetics. Like that's a reason not to do anything about it. Like it's not my fault. I can eat whatever because my genes. No, we're learning more about epigenetics now, where decisions you make, lifestyles you choose, can actually alter the expression of the gene
Mm.
that may lead you to diabetes or high cholesterol, high blood pressure. So God is so gracious, we have options. And so we can partner, genes notwithstanding, to learn new habits, to alter how the genes are expressed by the choices we make. So sometimes it's not a genetical, my brothers, it's because your siblings or your parents, rest their soul, didn't make the best lifestyle choices. And so you learn that, and so it travels down. I have seen patients outlive their parents. Their fear, shall I say, or the drive to not end up like them, propel them to exercise as an addiction. They go to the gym daily. So people talk about addiction. You could be addicted to good things,
Right.
and you could turn that tendency, to praying, to studying the Word of God, to exercising, to reading, to trying new sports, to learning something new every month. You could work that in your favor. So it, we got it. We've when God did a good thing, making us the way He did, we can adjust things based on decisions made. So sometimes, it's not the genetics. I've seen people outlive their parents, saying because I don't want to end up like them, I exercise. I essentially avoid the things my parents indulged in because I don't, and we celebrate that. And it's not to judge people, just saying, okay, is there some wisdom we're missing here?
Sure.
Are there things we can learn from the patterns, and how do we shift so we can live out why we exist, right?
Sure.
Yeah, because we need this body to do the things.
We sure
Yeah.
do. So, Dr. Tolu, I am a patient listening. I am diabetic. Can you tell me three things I can do to not pass this on to my kids? And I want to
Number
break
one, make
this.
sure
Yeah.
break it down. Okay.
Yeah.
Number one, know what type you have. Type 1, type 1.5, type 2. Know what type you have. Learn, and then number two, learn what foods work for you and eat them. And it's not just how it feels here. It's how it feels in your body, how it translates, how it's broken down. So your labs will tell you that. And then start with whole foods. Add whole foods. I don't want to say more than three. Add whole foods, food that are in its most natural form. And know what that means. Some people are like, well, rice is, well, white rice is processed. You know, wheat bread, is it whole wheat? Like, know the foods, whole grain, whole foods. When is the last time you ate foods that you could recognize relative to where they got it from the soil, right? Move more and make it not an individual movement, make it a collective movement. Tell your friends, share this video. What Dr. Cindy is doing, don't keep it to yourself. Put it in that group chat where people always gossiping about other people. Put this in there. In that group chat, they always, send it. This is the kind of message when it's like, hey, I thought of you. I love you. I care about you. I haven't checked on you in a minute, but I just thought I'll send this video to your DM because I
Yeah.
love you. This is one of it. Like, let's do the thing.
Sure. And for my patient with the hypertension, three things, Dr. Tolu, that I can do to not pass this on to my next generation.
All right. So number one, exercise, move, and make it exercise on their time. So you work, you spend a lot of time at work, find creative ways to exercise while you do that. Okay.
Right.
Number two, salt. Know what's salty. Don't tell me you don't add salt to your food. If you eat not a lot, you eat a lot of salt. So just cut down the salt. Get used to other flavors. There's cilantro, there's curry, there's thyme. Man, the other things your taste buds are craving outside of salt. And then three, ooh, careful how you adjust to stress, because stress is a big cause of high blood pressure, and the way you react to stress, people learn. Your kids learn. Sometimes societies learn. Sometimes, overreacting and is learned. So start to pay attention. How do you handle stress? What are your coping mechanisms? What are ways you can strengthen your coping mechanisms so that your blood pressure doesn't go up because of stress?
Yes,
Yeah.
yes. And then our final one for today, Dr. Tolu, for my patient with the high cholesterol, and they're really struggling, but they absolutely, and I know there's like a familial component to it sometimes, right? But yeah, three tips for them.
All right,
Yeah.
so for cholesterol in the U.S., cheese is the number one cause of high cholesterol. So I'm not saying don't eat cheese, just know where cheese is. So in your salad, in your dips, in your dressings, in your sandwiches, in your soups, and condiment, like it's there everywhere. So just be mindful of it. And then add more fiber, your fresh fruits and vegetables with every meal. It will come down. And then I would say things like chia seeds, your flax seeds, your healthy oils, they kind of punch out the the bad fat. So it helps balance that. And then thirdly, like I said with the other two, exercise, move, make it part of who you are. Yeah. Move more, exercise. Yes.
Oh, Dr. Tolu, I would love to be a patient of yours. I would absolutely love. I will fly down there. You're my new PCP.
Be honored. I'll be honored.
Yeah. Aw. Yes, Dr. Tolu. So, in terms of, like wrapping up right now, any like final words for our patients listening, our friends listening, our family members listening, in terms of the diabetes, the hypertension, and the hyperlipidemia, and what we can do to keep it, break that generational curse, get it out and keep it out of our families.
So first, I will start with the fact that you are created for something beautiful, something wonderful. You add value to the world. You're an expression of God's beauty, God's grace, God's glory. But to express that, you got to keep your body intact. So we need to control that. And so I want to encourage you. There are ways to do better when it comes to your health with diabetes, high blood pressure, and high cholesterol. Please partner with a clinician, a physician like Dr. Cindy or myself, to help you make those lifestyle changes and keep you encouraged and help keep you consistent, because that's another challenge. But there's hope. You can feel better. You can do better in this day and age. Yes, you can. So don't give up on your health.
Thank you, Dr. Tolu. That's so needed. I'm taking it to heart myself. So, Dr. Tolu, if someone is listening, they really loved you like I did today, how can they find you?
You can find me on YouTube, Dr_Olabintan MD. You can also find me on Facebook. My name, Tolulope Olabintan. Our website for the practice is www.livingspringmedicals.com. And there's a place where you can send me an email. And you can find me, if you Google me, you find me all over the place.
Do
Yes.
you do telehealth
I do
appointments?
telehealth. Yes,
Okay.
yes, I do.
And do you take out of state patients at all, or?
So I do in Oklahoma, Tennessee, in Texas, and in okay, yeah, those three: Oklahoma, Texas, and Tennessee. Those three for now.
Okay. Okay. Guys, you heard it. You heard where she's located. As I said, I would happily be a patient of Dr. Tolu's. If you guys need any lifestyle medicine coaching, if you need any obesity medicine help, or any family practice services, definitely, and you're located in those states she mentioned, definitely check her out. Dr. Tolu, it was such a pleasure having you on the Care Room today. I appreciate your time. I know you're a very busy lady, a very powerful CEO. You're doing great things where you are. So grateful to God for you. I appreciate, your time with me and our blossoming friendship. I'm really grateful for that as well. So I just want to say thank you.
Thank you for having me. God bless you. Appreciate you. Yeah.
Thank you. Anytime. Are you open to coming back? Anytime?
Oh yes. Oh, definitely. I'd
Okay,
be happy
okay.
to.
Because we want you back. We want you back on the Care Room. All right, Dr. Tolu. Thank you again.
Thanks for spending time in the Care Room today with Dr. Cindy. If you liked what you heard, please subscribe, share this podcast. I'm also on Facebook and Instagram. You can follow me there. Remember, you're not alone in this. There are doctors who do care. The information in this podcast is for educational and informational purposes only. It is not a substitute for professional medical advice, treatment, or diagnosis. Always consult your personalized healthcare provider for medical guidance.